Welcome to YouTube Live. Today we're going to talk about a case study. 27-year-old male, suffered for 2 years with back pain and sciatica. But again, why do we do this? We do this so you know you have options. What the options are, what the benefits of certain treatments are, and more importantly, patient-reported data helps you make better decisions. This is all about patient-reported data. So, case study number 4, 27-year-old male, so he's younger than the last couple of case studies, late 20s, suffered for 2 years with back pain, leg pain, and sciatica. And before he came to see us, he saw 5 different doctors. So he had seen his general practitioner, had seen several specialists, and I also know that he had some cortisone injections. So he saw a lot of different doctors for this original problem that he'd been working on for 2 years trying to resolve this problem. Saw 5 doctors, they gave him an MRI, and during that 2-year period, again, he was suffering for 2 years with this problem. He had tried physical therapy, was taking a anti-inflammatory. Also, he had 5 injections into his spine, in the area where the sciatic nerve was. He was taking narcotics, okay? And again, the whole idea here is what happens with the therapy? What is the benefit? Well, in his case, he had gone through these 4 different therapies and was absolutely no better off. He was in a lot of pain. He then came in to see us. So be aware that the outcome for these treatments wasn't very good. Came to see us, and we do everything without any drugs or surgery. That's the most important part. Everything we do is without any drugs or surgery. We try to solve the problem. We try to solve the problem at the source. What's causing the problem? Well, we know that sciatica, there's 5 different reasons. So when patients come in to see us, we do a very specific type of diagnostic evaluation. Our goal is, through our diagnostics, to identify what is causing the sciatica, what is pinching the nerve. So in his case, we did the MRI. What we found was degenerated disc. Now, it's not uncommon for a 27-year-old to have a degenerated disc, but it's typically not the first thing we would look at because sometimes it's a couple of years down the road before the discs degenerate. But obviously, he'd had some pretty severe problems causing him a degenerated disc. He also had a bulging disc, and the combination of these two was causing pinching of the sciatic nerve, and we call that sciatica. We have a 9-step process to get you better if you have sciatica. Step number 1 is identifying the true cause. So when he came in to see us, his back pain was an 8. His back pain and his leg pain was an 8, which is pretty high. It's pretty high considering, number 1, it's been going on for 2 years. Okay, 2 years is a long time to have pain that severe. 2 years is also a long time to having gone through all these things, still taking narcotics with a back pain 9. His Oswestry Disability Index, and when we identify how severe the problem is, the 2 variables that we look at is pain and Oswestry. Now, pain is a scale of 0 to 10. 0 is no pain, 10 is severe pain. Again, his was an 8, pretty high. When it's an 8 every day, it kind of wears you out. He was worn out. He was suffering. He was suffering. He was suffering, but he was also a little bit sort of nervous about what his future was going to look like. It's not uncommon you have all these therapies and nothing makes you better. It starts to work on your brain a little bit. Okay, wears you out, makes you a little bit depressed. Okay, definitely suffering. His Oswestry Disability Index is a 60. The Oswestry Disability Index is a questionnaire that we have you fill out and we give you a score. And that is scored from 0 to 100. 0 being, no pain, 100 being it's completely compromising my life. And the disability index is what effect does the pain have on your life and your lifestyle? How does the pain affect your ability to walk, to sit, to sleep, to drive a car, things like that? Okay? So in his case, having a pretty severe compromise of his life and his lifestyle. The disability index is scored, and there's 5 categories. The first category is what we call minimal disability. It's from 0 to 19. Moderate disability is from 20 to 39. 40 to 59 is severe disability. 60 to 79 is what we call crippled. 80 to 100 is bedridden. Now in his particular case, he was a 60. Okay? So he was crippled. You know, crippled from the point of view that the pain is affecting his lifestyle in such a way that he can't do his normal activities. Pretty severe case. Pretty severe case. Headed directly for surgery. If he didn't come see us, he was headed directly for surgery because he'd failed all these other things and got to the point where he couldn't take it anymore. Came in to see us, put him through the 9 steps. As he went through the 9 steps, 40 treatments. 40 treatments. Our goal is to take pressure off the disc, eliminate the pinching of the nerve, okay, get the spine functioning better. 40 treatments. At the end of the 40 treatments, takes about, in his case, maybe it took about 4 months. 3.5 to 4 months. It's usually 3 times a week for 12 weeks. That would be 36. His was 40. So probably 3 to 4 months, somewhere in that point now. His back pain was a 0, and his oswestry was a 20. Now our goal is to get your oswestry down to 20 and below. Anything 20 and below is what we call the safe zone. He was living his life in an area where he couldn't do anything, and we got him down to a minimal disability. He was able to live his life again. So what does that mean? It means if you have sciatica that's not going away, and you're afraid, or your thought is maybe your next step is surgery, okay, here's a perfect example of what we can do. There's a young man, had been suffering for 2 years, and he was suffering, came in and he got better. And he was better. That is case study number 4. So the question is, why do we do this? We do this so you know you have options. Patient-reported data is very, very, very important. The problem is providers do not have to publish their data. Providers don't publish data about what happens when you get their treatment. So the problem is you don't know what's best for you. Our goal is to help you so you know what's best for you. Okay? We are committed to publishing our data for transparency of what we have. Okay? This is transparency for what we have. So you can make clear, relevant decisions based on the information. We know the outcome for these therapies for this particular patient was bad. Okay? Typically when you've got sciatica as a result of these other problems, these therapies aren't typically very effective. Okay? He went from an 8 down to a 0, able to live his life with very, very, very minimal disability in all, relative to his disability. So that's our goal. This is case study number 4. Next week, Monday, we're going to do case study number 5. Thank you very much. There's some links in the description below for more information about who we are and sciatica. So feel free to look at that information, and we'll see you on Monday.